Welcome to our module on common lab results and how to read them. The information today is not meant to be memorized. See our worksheet to use as a helpful guide along with this presentation. The topics covered in this module are importance of lab tests, basics of reading your results, commonly used lab tests like CBC, CMP, A1C, Lipid Panel, and Thyroid Panel. These lab tests are done for two main reasons: to gauge overall health and to narrow down the problem if one is present. Your lab results could seem very overwhelming, but let's break it down. These are some basics when reading your results. The lab is the test that was done, which in this example is sodium. You will get a measured column, which is your level for that test. You will also see the normal range for any given lab for your age and gender. A complete blood count, or CBC, is a very common lab test to check your overall health. There are three main tests that are done: a WBC, a RBC, and platelets. Starting with a WBC count. WBC stands for white blood cells. This test looks for any signs of infection or if you may be at a higher risk of getting an infection. All of these are specific white blood cells: neutrophils, basophils, eosinophils, lymphocytes, monocytes, and bands. Your doctor may measure these to narrow down the type of infection. This slide focuses on the RBC count, also known as red blood cells count. This part of the CBC is looking for your blood health. The specific categories you will see under your RBC count include hemoglobin, hematocrit, MCV, MCH, MCHC, RDW, and reticulocytes. These are all ways of describing the health of your red blood cells. The CBC also measures your platelets. This test is looking at how well your blood clots. So let's recap the three main tests that make up a CBC. There is a WBC count, or a white blood cell count, a RBC count, or a red blood cell count, and platelets. A complete metabolic panel, or a CMP, is a test done to measure how well your body is using energy. A CMP will measure the health of your liver and kidneys. It will also measure the levels of your electrolytes, calcium, sugar, and protein. The tests for the liver are alkaline phosphatase, or ALP, alanine aminotransferase, or ALT, and bilirubin. Your doctor will use these tests to assess the health of your liver. For kidney health, your blood urea nitrogen, or your BUN, and creatinine levels are measured. Electrolytes are measured by your sodium, potassium, chloride, and carbon dioxide. Calcium is included in this set of tests as well. Your sugar is measured by the blood glucose test. Of the many things that can affect the blood glucose, diabetes is what your doctor is looking for with this lab. Your protein levels are measured by your albumin and total protein. Here is a complete CMP, but as we said, you can reference your cheat sheet instead of trying to memorize this. Now onto the special tests. These include a lipid panel, thyroid function tests, and hemoglobin A1C, or HbA1c. There are many special tests, but we will focus on these three. Lipid panels are tests that help to see if your blood vessels are clean inside. This panel measures total cholesterol, low-density lipoprotein, or LDL, high-density cholesterol, or HDL, and triglycerides. Fun fact, you ideally want all these labs to be low except HDL. The more HDL, the better. Thyroid function tests measure how well your body is controlling the use of energy. This test measures your T3, T4, and TSH levels. A hemoglobin A1C measures your blood sugar over the past 3 months. And there you have it, all of the common specialized labs. That concludes our module on reading your lab reports.